Hi everyone, so this video will be about the note-taking system I used for my Step 2 CK. We have different note-taking techniques, whether writing it on a notebook or typing it on a computer. For me, I did a switch in my note-taking technique for Step 2 CK, far different from my step 1 and med school notes. I did my typical notes in step 1 as I did in my med school, so I would write the things that I think are important for me in my notebook and did it per topic, per subject, and since step 1 has so many resources, I think what I did there was focus on pathoma and write the important ones on my notes, then add some notes from UWorld and FA, and also other resources as well. I completely turned it around for Step 2 CK. I realized that when using a notebook and referencing to my notes, it took so much time for me to find a certain topic I want to go back to, and in order to cut that time in finding that certain topic, and it's taking so much time, I decided to switch to a computer so it's easier to go back and find the topic. Well, it's just Control plus F, or for MacBook I'm using Command plus F. So for step 2, I switched to writing my digital notes and I was browsing a lot of productivity videos. I learned about Notion from this YouTuber Ali Abdal. You might be familiar with him. And then I started downloading it and learning about Notion. And as I was learning it, I thought, oh, this would be great for my step 2, and so I jumped into it. And for me, this made my note-taking system much more efficient and made my notes with the intent of being able to do active learning while reviewing my notes. I will explain this much better later in this video. So just a disclaimer, this is not an ad or anything. I don't think I have enough subscriber for that or anything, but I just want to share how this helped me in taking my notes. So a quick thing about Notion can be quite complex, and it might be complex for some to use. I thought it was so complex at first, and for me, once learned, this can be a very powerful productivity tool, not just for notes, but as an organizer as well. I made this my main life organizer because it has this good trackers in it. So as you can see, I am also using this for my USMLE workspace and Match workspace. So I put everything about my application progress there and tracker for where I am at in my application. Anyway, this is a video for my notes using Notion, so let's focus on that. This is how I organize it. This is my main USMLE Step 2 CK workspace, and as you can see here, I divided it first by subjects. At first, I separated medicine and surgery, but as I was doing my UWorld, I realized that a lot of diseases and topics in med and surg overlap, so I decided to just merge them together. And then there are also some overlapping topics with pedia, but there are much more in surg and IM. I decided to just do a separate subject for peds, and then I combined surg and IM, as you can see here, and then the other topics as well. Inside the subject, I organize it per system so that it is much easier to review. So as you can see here with the subject, the general knowledge and the immunization and screening, those are for ethics, and then the immunization screening are my notes for all the immunizations, all vaccinations, and all the screening tests, which are also important to know and very important to note in Step 2 CK. Let's dive into this. So this is how I wrote down my notes per system. When I click into this, there will be a table inside. You can add a table by clicking the slash and then make an inline table, and then you'll be able to make a table inside. The table would be comprised of topics. For this, it is the certain disease entity inside each topic. And these are the topics that are discussed in UWorld, and those are the topics that I encountered in UWorld. And next would be the most important parts of the UWorld discussion, and I base this on what I think are the most common questions asked in UWorld. If you watch my first video here, I discuss there the most common questions asked in Step 2 CK, and also the important parts to focus on a UWorld explanation or discussion. I basically use those for this table. So as you can see, this table is comprised of a disease or a topic that are discussed or asked in UWorld questions or UWorld blocks. Then the next column would be the clinical features, which is comprised of the symptoms and pertinent PE findings seen in that case. So this usually I put first what is the usual age of the patient, and then if not, just the patient, and then the common complaints of the patient, and then the pertinent findings, and then the pertinent symptoms, and then the pertinent findings, the PE complaints of the patient. So yeah, next will be the concepts. For this, I was just intending at first to write here the cause of the disease, like an etiology or an overview of the disease, but I realized later on in my review the importance of knowing the pathophysiology. I actually realized this after doing the self-assessment in UWorld, and then also the risk factors. I included this all here. I cannot stress enough the importance of knowing the risk factors of the disease in each case. So this is very important for Step 2 CK. So third would be the diagnosis. Here is where I write the initial test, and then what results should I be expecting in that case. And also the confirmatory or definitive test and the expected results for that as well. If there are ancillary tests here, then I would also put that if I encounter it in UWorld. Actually, UWorld won't just give you the what is the initial test or the definitive test for this. Usually UWorld will include some ancillary tests as well, so might as well know that. Lastly, the treatment. So for this one, I usually put the treatment of choice on top, then alternative treatments after that. What I realized while answering UWorld, eventually they won't really give the treatment of choice every single time. Of course, there will be cases where to know the treatment of choice is very important because they'll ask for it. But they won't do this every single time. Sometimes they would ask for the alternative treatment. So knowing the alternative treatments would also be helpful. As I was doing my Step 2 CK exam, this is the real deal, what I encountered was the treatment. They would sometimes give the treatment of choice included in the vignette, and then they would say like what else can you do to the patient, or what else can be the management to do to this patient. So for example, like after giving NSAIDs, what else should be done to this patient. So I think knowing the alternative treatments would be very helpful. When I click on a specific topic, it will lead me to a page inside, and this is where I put the more elaborate details and discussion about the disease. As you know, the table would be the overview and the most important parts of the disease, but then when I open it and click this disease, then I will see the more elaborate discussion on it. So this is the part where I put images, also summary tables. I know you know what I mean with this. So you can put summary tables here, and then algorithms as well. So this part is much more for reviewing the disease thoroughly and in more detail. For the table, I just do what I think would be high yield and put there. But here I put them more detailed on the clinical features. I list them all. I usually see the more detailed clinical features from Amboss. and also a much more deeper explanation of the pathophysiology. If UWorld would give me an illustration of the pathophysiology, I would put it here. Then if the topic is hard and I search for other sources for this, I put it here as well, and I include the link to that source. And then more diagnostics, this are the ancillary test and other diagnostics and the pictures of those. Like for x-ray, I put the pictures of x-ray here. For example, ARDS, I put ARDS x-ray here, just so I'll be more familiar with the photos and the x-rays that I would be seeing. Then for the management, I include here the adverse effects of the management and the drugs, there are any, and some more important details to know about the certain management. Also complications of management, like for example, complications of cholecystectomy or complications of bariatric surgery, something like that. I can also put a call out. So I usually do a call out for buzzwords as well. So I know the Step 2 CK isn't so much into buzzwords anymore, but I still put it just in case. And so this portion is very important when you're reviewing back a topic in much more detail. For example, you're already having your rapid reviews, but missed on something, then you want to review it in much more detail, then you can go here. I group these diseases per topic area, like I put leukemia together just so it's easier to compare them in a table, seeing them together. And then I put all, for example, lymphoma together. I put all anemia together. So I do that. That's how I organize it. And for the ones I always forget or things I deem very important, I highlight it in red just so I would remember it the next time. And yeah, I actually initially planned to rate my level of knowledge about each diseases, but I wasn't really able to do this. But I think it would be great to categorize this one as well. One of the things in this table is the ability to filter it with certain filters. So for example, you labeled this as a weak area. So you can filter this by the level of knowledge, and then just you wanted to see all the weak topics you are in, so you can filter all the weak areas in the table. So that is a very good part in reviewing back as well. I was doing this as I go along with the UWorld first pass, so I went along with it. I was just adding topics if that will be a new topic for me, or notes inside the topic if it will be a new information I encountered. It is easy in here to just add a topic. You just click a plus sign here and move a row if you wanted to, if you think it will be better with after that kind of disease, something like that. So I think it is very easy to navigate on the table, and I think it is easy to edit the table and add notes as well. So as I go through the first pass, I was adding topics here and there in the tables. As I go through my second pass, I would edit my notes, and this is where I add some more information that I missed, or some more information that I didn't type or didn't put in my notes, then I did that. So it's more for editing, and then another editing for incorrects. So the time I went to 2 weeks before my exam, I was able to do a rapid review with better notes and more structured one. So for Biostat and Ethics, I just did a usual topic, then I put all the discussions about the topic there, maybe examples and biostat questions, and also how to explain it. So using this was a lot easier because it is very easy to find a topic within the notes. Since UWorld is very random, there are random topics to review, so being able to find it easily for me was very efficient and cut the time in finding a certain topic within my notes. For example, I want to find multiple sclerosis inside, I would just do Command P, then it will give me all the multiple sclerosis topics in my notes. If I want to find it within the table, then I would just do Command F and I would be able to see it in there. As I was doing my active learning part of the review, I would hide the parts of the row. I would just put the disease and then hide the parts of the row, then try to fill in these parts in this table per disease and try to explain it to myself to see if I can discuss each topic individually. If I can't, then I will open the topic and review it thoroughly. I sometimes write this down, like I would do a table and writing this down with blank pages, and then I would just try to fill it in. I think that was a very helpful active learning process for me, especially in the last weeks before my exam. I think doing it in a tabular system made it easier for me to do rapid review of each system as well, since I can see the overview and the most important parts of the disease that I have to know for my exam. And again, note-taking system techniques vary, and I'm sure that there will be much more effective ways to do this and make notes about. This has been my process, and this has been very helpful for me in being organized with my notes and being effective with the rapid review as well. So I hope I was able to share something helpful to you today, and that's it. Best of luck to you and happy studying.